Hello, thanks for joining us today. Today we're going to be working on the 5 warning signs of addiction. But most of the time when I see students and do this presentation, we talk about a little bit of review from the past year. I've seen them typically in 7th grade, and then again, we will do this in 8th grade. And most of the time when I ask them, what do you remember from last year's presentations? Almost every single one of them says, I remember that black lung. Like the black lung thing seems to be one of those stick with you moments in your life where you remember it for the rest of your life because it's so incredibly horrible and disquieting. And basically that's an important memory that I want people to have. But most of the time, what I'm striving toward for this is I'm trying to get them to think about why I do drug education. Why it is it that I got involved with this ultimately? And what we basically come to I want them to think about the fact that I struggle with what's called substance use disorder. Now, we used to refer to this as addiction or alcoholism. Now we call it substance use disorder of the mild, moderate, or severe type. And you'll notice that I struggle with the use of those terms. I'll fall back into the old language of addiction or alcoholism. But why did we change it? Well, because being an addict or an alcoholic was sometimes it was almost a judgmental term in a negative sense. It was almost pejorative or negatively received or insulting to the person who struggled with that issue. Now the substance use disorder is called patient-centric or patient-friendly language. So that's great. I'm willing to go along with that. That's no problem at all. But you'll notice that I struggle with that. So I had substance use disorder issues. And basically when you think about the idea of substance use disorder, and you'll notice in the presentation that we haven't changed all of the terminology. We should probably get around to doing that. But in your head, when I say the word addict or alcoholic or substance use disorder victim, what does that look like? Everybody has a movie in their head of you're not confused when I use the terms. You know what I mean. Maybe you've struggled with some people in your family who have these things going on. Ultimately, though, everybody tends to understand what this stuff is. Now, here's the problem. If I asked you to define it, would you be able to go to another person and say, this is what it is? You could recognize it the next time you see it. Could you define substance use disorder of the severe type so that the next time somebody saw it, they would know what it was? That's harder. That's a lot harder. So ultimately what we want to do is this. Now, the National Institutes of Health has this definition, and they're going to define addiction or substance use disorder in this definition. But watch this as it unfolds, okay? Let me just play this for you, and we'll use the National Institutes of Health definition of addiction. So it's defined as a chronic relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences, and long-lasting changes to the brain. And a lot of people look at that and they're like, yeah, I thought the goal here was to clear this up, to actually make me capable of functioning within the definition and identify this when I saw it. That's not really that helpful. It doesn't really iron it out for a lot of people. So let's do this. Let's actually look at the idea of, let's take it one word at a time, okay? It said compulsive drug-seeking behavior. So ultimately, let's understand the nature of compulsion, okay? Picture compulsion like a big hand in the middle of your back, okay? Pushing you toward use. And ultimately, here's the thing. You can fight this compulsion, okay? It's omnipresent, it's ubiquitous, it's always there, but you can battle against it. What I want you to understand is it's a fight you can win occasionally, but it's a war that you're going to lose over time. The compulsion to use overwhelms most people's efforts to fight it. Let's think about the idea of compulsion, okay? How do you, imagine that everyone in this class right now is addicted to marijuana. So you're in a school setting. Typically, I work almost exclusively in schools. Let's imagine all of you are currently addicted to weed. The compulsion would then say that you want to smoke weed right now. That's the nature of this force, this urge to use. Can you adequately or functionally smoke weed in school right now? Probably not. Because here's the problem. You smoke weed in school, you're probably going to get bagged. You're probably going to get caught. Can you imagine sitting at dinner tonight trying to explain to your parents why you thought it was a good idea to smoke weed at school? And in my 26 years of drug education, I've been present at some schools where they caught kids using, and it's always, always awful. The kids are terrified. Their parents show up. They're confused. They're angry. They're disappointed. It's a nightmare moment. Most people agree it's a terrible idea to smoke weed at school. But how about that afternoon when you get home and your parents are gone, they're both at work, and maybe your older brother's out playing soccer. You've got the house to yourself. Are you more likely now to succumb to that compulsion to use than you were during the day at school? Yeah. So you can fight it during the necessary times when you need to fight it, but then later, when there's no reason to fight it per se, you might actually succumb to the compulsion to use over time. Ultimately, the compulsion wins almost all these wars. Here's the other question, though. When we talk about long-lasting changes to the brain, when you think about addiction or substance use disorder, why, when an addict can't get the drug, doesn't the addiction go away? How can addiction continue in the absence of the drug that caused it? Well, think about this for a second. If you're addicted to a drug and you can't get it, what do you think about in the what's your brain focused on? Is it like, okay, let's read some Shakespeare, that'll do it, yeah, a couple soliloquies and I'll be all set? No, what are you thinking about? You're thinking about your drug, okay? And the definition of an obsession is a thought which excludes all other thoughts. So ultimately, when you can't get your drug, what are you going to be thinking about? You're going to be thinking about that drug 24/7 until you can get it back into your life. Obsession fuels the addiction in the absence of the drug that caused it. So we got compulsion and a long-term brain change basically based in obsession. But here's the thing, there's another one. It said continued use despite negative consequences. So imagine you're like a drug dealer and you get caught dealing drugs and you end up in court and the judge goes, okay, guilty, and you're going to do 5 years in prison. And you'd probably be like, wow, that's terrible, I should probably stop using. No, not if you're an addict or a substance use disorder victim. You basically are like, this sucks, I need to get high. So you continue despite negative feedback from your use. That's a really problematic part of the definition. So let's do this. Let's redefine addiction away from the National Health Institute's wordiness and kind of summarize it. Here, obsessive compulsive drug seeking and use that doesn't stop when the use directly harms the user. That's pretty simple. Obsessive compulsive seeking and use that doesn't stop when the use directly harms the user. Hopefully you're a little bit more comfortable in the definition of substance use disorder of the severe type. Are you comfortable? Do you understand the words? And most of the time when I'm in the classroom, the kid's like, yep, absolutely, got it. Okay, if you got it, let's give you a quick test. Is this person suffering from substance use disorder? Are they addicted to this drug? Let me give you the situation, okay? A patient in a hospital is experiencing so much pain that if the doctor doesn't treat their pain, they will lose their mind. They'll go crazy with agony. And so ultimately, the doctor treats the patient's pain with the addictive drug morphine in large doses every 4 hours for a year. At the end of the year, is the patient addicted to morphine? Most people are like, well, yeah, it's an addictive substance. You're getting it in large doses every 4 hours for a year's time. How could you not be addicted to that substance after that kind of exposure? Here's the problem, though. Let's do the definition one more time, okay? Obsessive compulsive drug seeking and use, which doesn't stop when the use directly hurts the user. Now, the patient being given the drug by the doctor without request or just they don't have to work for it. Is that obsessive and compulsive seeking and use, or is it simply being provided by their medical care provider? It's being provided. It doesn't meet the first criteria. How about this use? Is it hurting the patient or helping them in greater measure? Well, it's helping them. So here's the problem. Have we met any of the definitions of addiction at all? No. This patient is not an addict. It's really important to understand. You can use addictive drugs for long periods of time regularly and not become addicted to them. But here's what we have to understand. People exposed to drugs over time adapt to them. Look, think about it this way. Every time a person is exposed to a drug that has the power to cause addiction, the body changes so the next dose of the drug is less powerful. Well, why would that be? Well, think about it this way. Whenever you expose a body to a drug, okay, the body before the drug exposure was in a state called homeostasis. You've probably heard this term in your science classes. It's basically balance. You guys right now, biologically speaking, you are optimally homeostatically balanced for optimal performance, okay? So your homeostasis is a set point which can be adjusted according to the need of the moment. Here's the thing. When you put a drug into that system, what happens to the homeostasis, to the balance? It's thrown out of whack. The brain hates that. It can't stand that kind of imbalance. It wants to work back toward homeostasis. So what does the body do to make the next dose of the drug less powerful? Changes its brain chemistry. The body adapts to the presence of the drug over time. So each successive dose causes the body to react in such a way as it balances the presence of the drug out. And so you create this new homeostasis, which now includes the drug. So now you've got this new definition of balance, which includes the use of the drug regularly. You have come to tolerate the drug better. Now, here's the problem. Once the medical condition goes away, what happens when you take the drug away from the patient? If you take the drug away from the patient, essentially what you've done now is thrown the homeostasis out of whack the other way. So you were balanced, knocked out, worked your way back toward dependence, and then knocked out again and withdrawal. What we just did was define a very, very definitive, kind of predictable process. When you take a drug which has the power to cause addiction, over time, you become tolerant, you become dependent, and then you go into withdrawal if the drug's taken away. These are component parts of addictive behavior, but they're not definitive of it, okay? And by the way, withdrawal is extremely uncomfortable. And so ultimately the question then arises, well, wait, if the patient doesn't need the drug anymore, but it's going to be horrible for them to come off of it, how do we get a patient off a drug once the need for it goes away? What you do is, of course, you already know the answer, right? You take it away a little bit at a time. You do a thing called detoxing. And so ultimately, they take you off the drug a little bit at a time. Now, here's the problem. High dose morphine patients, like we just described, can take 6 months to detox. 6 months to get off the drug that they were dependent upon because their physical needs, their physical body responded to the presence of the drug in such a way as you take it away, the body goes incredibly the other way and becomes very uncomfortable for the patient. So how do you do it kindly and gently? Well, you walk it off slowly. It can take up to 6 months to occur. Now, here's the problem. Does the American medical infrastructure provide for that kind of care? Will a nurse or a doctor or a psychologist sit with you and hold your hand and say, it's okay, it's all right, I know it's uncomfortable, but we're going to get through this together. We're a team. No, they just don't. And it's not that they don't want to, it's not that they don't care, it's just that it's not the kind of care that we can provide in today's medical model. It's just not something that's going to happen. Now, I want you to understand, the next thing we're going to talk about is wildly oversimplified. It's wildly oversimplified, but I want you to get the notion of how you would actually go about this detox if you were on your own and left to your own devices. So imagine the doctor says, okay, here's what we're going to do. I'm going to send you home and give you some pills. What I want you to do is take one of these pills every day. Now, next month when you come see me, we'll drop the dose down a little bit, but you take one pill every day, and the next month we'll drop it down a little, we'll drop it down, and ultimately that's great. Now, here's the problem, okay? You take one of these pills, and remember, you're being taken off this drug by providing a lower dose. So the lower dose is not quite where your body needs to stay balanced, so you go into a bit of withdrawal. Now, here's the other problem. You got to get your kid to daycare. You got to go to work. You got to do that PowerPoint presentation for your boss, and you feel like garbage. You feel terrible. You feel slightly nauseated. You've got slightly loose bowels, a little bit of diarrhea. You feel achy. It's almost like you have the flu, but you still got to do this job, right? And it feels awful. So what you figure out really quickly is this. Okay, so one doesn't work. Maybe if I take two. So you take two, and guess what? You feel normal again. You feel completely normal again. So you take two, and everything's working. Now you can go to work, get your kid to daycare. All this stuff is working for you. But remember, you're taking two when you should have taken one, and you run out. You've used them too quickly. So you got to go back to the doctor because you're out of the pills now, and you go back and go, doc, those pills are working great, right? I'm totally on board with it, but I need some more because I kind of ran out. And the doctor looks at your chart, and they're like, see, we got a problem here because I told you to take one, and you're taking two. And that's not okay. You're abusing the medication. And federal law says, I can't give you more of a medicine that you're abusing. So I can't give you any more. I'm sorry. I wish I could help you, but I can't. Now, again, wildly oversimplified, but again, it addresses a core issue here. What happens when you can't get the drug the doctor is providing for you? Well, now you're not slightly in withdrawal, you're deep in withdrawal. And I need you to understand this is a horrifying, hellacious existence. You feel like you'd rather be dead than feel like this. And so the doctor has basically told you, you're abusing the medication, I can't give you any more. So you're left to your own devices. Now, here's the problem. The brain does not care from whence the opiate came. It doesn't care where you got your drug. And so ultimately, opiates like this drug that you were taking to substitute for the morphine are available in the street. But the problem is this, in the street, they're extraordinarily expensive. And you got to find a connection which is stable and reliable. And there's all kinds of risks out there around fentanyl, this really powerful opiate, which will kill you in a New York second if you take too much of it. And you can't tell how much is in each pill you're buying. And they're super expensive. So you got to get money. You got to get a new connection. You got to get all these drugs on a regular, illegal basis. Here's the problem. What has the patient become? Are they obsessively and compulsively seeking a drug despite the fact that it's causing them grave negative consequences in their life? Addiction, substance use disorder is not just about drugs. It's about behavior that surrounds the use, okay? So ultimately, the patient has become what we refer to as a substance use disorder sufferer or an addict. The big question that we have to force ourselves to ask here is, Is it the patient's fault? Is the patient in any way weak or lacking in character because of the fact that they responded to this way? Not even close. The problem is this: when we get involved with opiates, we are wildly ill-informed about their power and their potential for grave difficulty later on in their use spectrum. I'm taking a class, and I have this Harvard Extension class I'm taking. It's called an edX class on opiate epidemic. And basically, there was a doctor in a video in there, and he said this. He said, when you think about patients taking opiates, okay, give me 100 of them coming into my office for the first time. I want you to remember the number 15, because after 1 year, 15 of those 100 people will still be taking the drug that I gave them today. 15 of 100 will be caught in a syndrome of use, which is really, really hard to break out of. It isn't the patient's fault. It is, however, incumbent upon us to understand these drugs are serious and powerful. Lots of drugs are misunderstood by the initial user, and they don't quite see how this is going to shake out really poorly. But remember this: 80% of addicts today who use heroin or other opiates addictively got their first dose of those drugs from a doctor. And it's not that doctors are irresponsible here either. That's not the message. Treating pain is wildly difficult. And basically, if you are treating pain with opiates, it gets really crazy really fast. So ultimately, obsessive compulsive drug seeking and use that doesn't stop when the use directly harms the user is the definition of addiction. But unfortunately, regular users who take medicine can end up on the wrong side of the fence through no fault of their own, because these are wildly complicated drugs. Now, how many people ultimately over time will ever be addicted to any drug of any type in the entirety of their lives? Out of every 10, how many people will ever be addicted to any drug in their entire lives? Now, before you answer, you have to take out 2 drugs, okay? The first drug you have to take out is caffeine. Why do you have to take caffeine out? Because 90% of American adults use caffeine on a regular basis. 80% of American adults, 8 in 10, use caffeine daily. So if 8 out of 10 people use a drug every single day, it's pretty easy to leap to the conclusion that many of them are addicted to caffeine. If you include caffeine, the numbers skyrocket. You can't get a meaningful number out if you include caffeine. Now, is it the end of the world to be addicted to caffeine? No. It's just not. It's not that kind of drug. You are not allowed to burst into tears next time your mother drives to the Starbucks drive-thru. It's not going to be like mom in the street hijack a Mercedes to get her next venti latte. She will not be capping passengers in order to get a cup of coffee. Caffeine addicts do not sell their babies for $5. Meth addicts do that. But basically what you have here is a drug which is important, definitely has the power to cause addiction, but when people get addicted to it, as long as they get their daily dose, it doesn't change their behavior meaningfully. Caffeine does not rip the fabric of society. Now, how do you know if you're addicted to caffeine? Stop using it for 24 hours. And if it feels like somebody buried a hatchet in your head, that's the signal for caffeine withdrawal, headaches. So if you're addicted to caffeine, drink it and you don't get headaches, it seems like life's pretty functional. I'm not excusing it, but it's not something you spend a lot of time worrying about. Now, the next drug you have to take out before you answer the question, how many people out of every 10 will ever be addicted to any drug at any point in their entire lives, is nicotine. Nicotine is a problematic drug because of this, okay? Now, if you included current US smoking rates in this number over the 10, how many people out of every 10 will ever be addicted to any drug at any point in their entire lives? The number would barely change if you included nicotine, because we smoke at such a low rate right now as a country. We used to smoke at almost 50%. Now it's falling down under 12%, I believe, right now, of the adults in America smoke tobacco. We really have won this fight. Now, vaping's another issue. We've got to worry about that. But basically, we kind of won the tobacco fight in this country over about 50 years. But other countries have not won this fight yet. The day they started the torch at the Sochi Olympics in Russia on 2014, the day they lit the torch in Sochi, Russia, 7 out of every 10 males over the age of 18 was addicted to nicotine on that day. 70% addiction rates the day they lit the torch in the Sochi Olympics. That's enormously troubling, because the number over the 10 is a 7.1. That's insane. So basically, you have this, okay? So and when they started the Pyeongchang Olympics just 3 short years ago, in 2018, it was 56.4% of Korean males over the age of 18 had a nicotine addiction. So it's really problematic if you include nicotine in the number. So take out coffee, take out nicotine, what's left? alcohol, marijuana, cocaine, methamphetamine, all of the opiates, including opium, codeine, morphine, heroin, OxyContin, Vicodin, Percodan, Percocet, Darvon, Darvocet, every other drug known to mankind that has the power to cause addiction except caffeine and alcohol. How many people will ever be addicted to any of them at any point in their entire lives? Now, when I talk to the class, almost always the class will say, 6, 7. And what I say when they they'll 4, 5, 6, 7, I say keep going, and they think I mean keep going up the number scale. No, I keep trying is what I meant. Ultimately, I will always get a class member, at least one of them, to say 9. So 9 out of 10 people addicted to drugs or at some point in their entire lives. Does this world function if 9 out of 10 of us become addicted to drugs at some point in our entire lives? That's not going to work out. Can you imagine going to your 25th class reunion and having 9 out of 10 people struggling with substance use disorder issues? It's like, where is everybody? They're all dead. They're all in rehab. They're in prison. All these horrible outcomes which come from all of these behaviors. Ultimately, is 9 in 10 even sustainable? Of course it's not. Ultimately, what's the answer? When you talk about the idea of how many people will ever be addicted to any drug in their entire lives, the answer is 1. 1 in 10. That's the answer. That is the normative societal risk for addiction is 1 in 10. 10% of people will ever be addicted to any drug in their entire lives. That's really hopeful, right? Now, here's the problem. It's not a great number. It's better than 9 out of 10, but if you think about it, 10% is the normative lifetime risk. At any given moment, how many people out of 10%, how many of that 10% are actually addicted? Usually, if you look at any given society in any given moment, somewhere between 3 and 8% of the population will currently be addicted to drugs or alcohol. So ultimately, 3 to 8% is currently addicted. Which way do you think the US skews on this spectrum? Toward the upper end or toward the lower end? Unfortunately, this is a country which struggles a lot with drug issues. So we have an upper end experience. So what we have is this. If you think the 1 in 10 is good news, think about the reality of that measure, okay? We have about 330 million people in America today. 1 in 10 of them represents 33 million potential addicts. 3 to 8% currently addicted, with the US at the top end of that spectrum. We currently have, depending on the study you cite, somewhere around 24 million people who need treatment in the worst case scenario. Somewhere between 21 and 24 million need treatment right now. Here's the second saddest thing you will hear all day. Of those people in any given year in the US, about 11% of them will actually get treatment in that given year. So out of the 24 million people who need it, we're going to have about 2.6 million people treated. Here's the saddest thing you will hear all day. Of the 2.6 million, if it's their first time getting treatment, they will fail at their attempts to stay clean at a rate of 85 to 90%. So we have 33 million potential addicts, 24 million actual addicts. Of the ones who go into treatment, a couple of 100,000 of them actually make it out, and the rest of them fall off the cliff for another grind. Essentially, 1 in 10 is a desperate number. It's really cause for great concern. Don't think that it's light duty just because it's 1 in 10. Now, one more cautionary note before we proceed to the next section. Basically, these numbers, this 1 in 10, this 3 to 8%, this 24 million people needing treatment, these numbers, the 1 in 10, only works in huge random groups, okay? You have to gather large numbers of people in random fashions in order for these numbers to flesh out. You have to fill a stadium with people, like 30,000 people, before these numbers actually flesh out. But if you put 30,000 people in a stadium and they're randomly selected and follow those people for a lifetime, about 3,000 of them will ultimately be addicted to drugs and alcohol in their lifetimes. The rest of them will not. So the 1 in 10 holds in large random groups. You cannot do 1 in 10 of a class or of a school. Those are not large or random enough to actually be powerful enough. Now, maybe you could do it with a college that has 60,000 students, but our college is actually randomly selected. Not really. People who attend college are of a certain stripe, a certain type. Maybe it won't work there because these numbers are not necessarily randomized. So in large groups, randomly selected, these numbers are absolutely accurate. 1 in 10 people will ever be addicted to any drug at any point in their entire lives. That said, can we predict which people will struggle? Can we predict which people will have worse outcomes? Yeah, there's some warning signs. We're going to talk about 5 of them today. The 5 risk factors for addiction or substance use disorder or alcohol use disorder or opiate use disorder are pretty clear. Now, there's 5 of them that we're going to cover today. These are not exclusive or all-inclusive. Basically, there's more, but these are 5 super powerful predictors of bad outcomes. Okay, now the first one is interesting. The first one is not a warning sign for addiction. It's a warning sign for what you have to do before you can possibly be addicted to a drug, which is use it. You have to use before you can experience substance use disorder. You have to drink before you can experience alcohol use disorder. So basically, the first risk factor is for use. What's the biggest risk factor for use? And when I ask the classes, a lot of times the classes are like depression, anxiety, all good answers. A lot of people say peer pressure. And peer pressure is a wildly misunderstood term in our society. Sometimes adults use peer pressure to indicate that if your friends do something, you will mimic it like a brain-damaged sheep. Thanks for your vote of confidence, Mom. We don't mimic other people's behavior without question or by default, but we do mimic behaviors that gain us social traction. So remember, basically, we tend to hew to the group behavior. If you're with a group of people who have great social power over you and you want to join that group, you tend to behave like that group behaves. So basically, the first risk factor is environment. So when you are talking about substance use issues, remember, if you saw last year's introduction, one of the things we said was if you spend time around people who use, you are more likely to use yourself. Where are teenagers most likely to use? They're most likely to use at parties. And so ultimately, if you're attending a party and people are using, you are more likely to participate because that gains you the acceptance of the group. So if you walk into a party where 70% of teen drug and alcohol use occurs, that's the behavior you will observe most readily, and it is most easily mimicable behavior. If you spend time around people who use, around people who drink, you will use and drink at a higher rate, whether you initially intended to or not. Now, if you remember from last year, one of the things I asked you was, who are you? What do you want? How are you going to get that job done? One of the things that is incumbent upon you, if you want to not use, is to not spend a lot of time around people who do. Now, notice I did not say don't go to parties. That's not what I'm trying to suggest. That's a complete non-starter. Here's the solution. You guys just don't go to parties. And you're like, shut it, old man. You need to go away. You're totally lost. No, go to parties. Have a great time. But don't hang around parties where people are drinking and using. It's just not good for you over time. Number one risk factor, or the number one risk factor is environment. Now, the next one is a direct risk factor for addiction, okay, for substance use disorder, is it runs in families. Substance use disorder runs in families. It is now your responsibility to find out your family history, because the normative 1 in 10 changes dramatically with one parent's issue. If one parent struggles with substance use disorder or alcohol use disorder, you are now, your number over the 10 is not a 1, it's a 4. So if you have a parent who struggles with addiction or alcoholism in their life, your 4 in 10 chance, your 1 in 10 becomes a 4 in 10. If you have 2 parents who are, were, or ever will be addicted to drugs and alcohol, you're a 6. Parental addiction or alcohol use disorder pertains directly to your risk. It is a genetic hand-me-down. So notice this. Your parent could be completely clean for their entire life, give birth to you, stay clean for 10 more years, and then suffer with alcohol use disorder. You got it. Wait, I was out of them when they finally got this thing. No, here's the thing. They didn't get it because of their bodies. They got it because of their genetics, and they passed it to you because of your genetics. Basically, you inherit the genetic risk factors for addiction. Now, there's not just one. I think there's like 100 something of them that are indicators of future addiction. These genetic variations are really hard to track, but we basically have found out that addiction tends to run in families. If you have it in a parent, your numbers really skyrocket. Now, that then tends to make us ask the question, what if both of my parents are clean? They're totally completely without these issues, but my grandparents struggle. So grandparents are 2.5. So 2.5 and 10. An uncle is a 2.5. An aunt is a 2.5. So basically, if it comes to the grandparent influence, it's about a 2.5. If it comes to the parent, it's a 4. If it comes to new parents, it's a 6. So you have to ask the question now, what's my family history? Do you know? Well, my family history and Kelly's family history are enormously, they're really complicated. So my great grandfather was an alcoholic. My grandfather was an alcoholic. Of my grandfather's three children, two of them were alcoholics, including my mom. My mom had five kids. Of her five kids, four of us are addicts. So that's quite the family history. And you might think, well, gosh, if you knew all that, why would you ever choose to use? Well, guess what? We didn't know this. This information was not readily available to us at the time. And basically, even if it was, even if I knew, I would not necessarily have known my family history. Because here's the thing, families are incredibly good at hiding their stories, at misleading young people, and then maintaining that mislead over their entire lives. Here's the problem. Family lies once told tend to stay told. And so ultimately, if you were 6 years old and your grandmother fell down the stairs for the third time that year, and everybody's like, your granny's a silly, clumsy goose, isn't she? No, Granny suffers from alcohol use disorder. Granny is an alcoholic. And basically, why would they not tell you that? Because you're 6. They're not going to be able to. Now, listen, Granny suffers from a compulsion to use the drug alcohol obsessively and compulsively, even despite the fact that it causes negative consequences in her life. And you're like, stop using big words, Mommy, you're scaring me. Basically, you don't tell a 6-year-old that their grandmother has alcohol use disorder. You tell them that they're clumsy. Now, again, family lies once told tend to stay told. So ultimately, you think Granny's clumsy. Actually, you have a family dynamic of alcoholism in your family, and that is something you need to know. So you have to ask the question, what's your family history? Well, my family, my uncle, the one above my mother's brother, is the friendliest guy you ever met in your life. He was the mayor of his town. He was this hail fellow well met. Kids loved him. He was the one who always did the games with the kids. He was a really lovable character, but he was an alcohol use disorder victim. My mom was a closet drinker. My mom suffered from alcohol use disorder of a different stripe. She drank problematically, but episodically. So she wasn't always drunk, but she drank very problematically, but she did drink. That was the problem. I didn't know my own mother suffered from alcohol use disorders until I was a drug educator for 5 years. So it's really hard to see this stuff. My grandfather, he had his first drink at the age of 31. He was dead at the age of 36. He drank himself to death in 5 years. Here's the thing. My grandfather was an alcoholic during a time when that was considered shameful. You were lacking in character. You were weak-willed if you were an alcoholic. And so basically the family was so embarrassed of him that they erased him from the family history. I did not know my own grandfather's name until I was 35 years old. They very effectively eliminated him. I had a Nana on one side and a grandma and grandpa on the other side, my father's parents, but my other grandparent, no one ever addressed it. It was gone, erased. There is one picture of this man left on the planet. The rest of them were destroyed. And my great-grandfather, I did not know he was an alcoholic or an alcohol use disorder victim until my mother's funeral. So all of this information, which I could have based decisions upon, was not usefully available to me or my siblings, who all really struggled, except one sister struggled with substance use issues in their lives. So we need to ask the question. Now, be very careful, because when you go home and ask the question tonight, you can't go home and say, hey, Mom, do we have any alcoholism or drug addiction in our family? I need to know before I start using. And your parents will be like, yeah, okay, right, start using. Go to your room and don't come out till you're 25. Basically, you have to go home and say this. This guy at school today said that if we have a family history of substance use disorder or alcohol use disorder or other drug use disorders, I'm at risk. Would you please tell me if I'm at risk? And here's the other thing. Remember the 4 and 10 and the 6 and 10? So we got my side. My daughter is a 4. Now let's run Kelly's history, okay? This is my wife. Kelly is my partner in business. Kelly's grandmother and grandfather were both alcoholics. Kelly's mother and her aunt were both alcoholics. Her mother gave birth to 3 daughters. Kelly basically and one of her sisters became substance use disorder victims because of their family history. Notice this incredible legacy of alcoholism in Kelly's family. And then my family, here's the thing. Kelly and I got together, both having struggled with these issues in our lives, and we had our daughter who went to OSHA, to the Orange County School of the Arts. Our daughter is what's her number? My daughter's a 6. 6 in 10 children like my daughter will become substance use disorder victims in their lifetimes, especially around the drug alcohol. Do you think I want that for her? Do you think I want that for this kid? Of course I don't. But here's the problem. Can I change my daughter's DNA? No. What can I do? I can empower her to make choices around her use by informing her, by telling her what she needs to know before she makes these decisions. Now, when would I tell her, I have to tell her right about your age, right about before 14, okay? Because people who use under the age at 14 or younger have enormous risk, which is now the third risk factor. The third risk factor is early inception of use. If you start using when you're young, especially the drug alcohol, the numbers are enormously negative later on as in adulthood. So do this. Give me three age groups, okay? 114-year-olds, 117-year-olds, and 121-year-olds, and have them start drinking regularly at that age. Now, first of all, what's regular drinking? Ultimately, it's hard to put a number on this, but I saw one time and they said, if you get drunk 6 days out of each 30, you're a regular drinker. So if you drink to intoxication 6 days out of 30 in each 30 days, you're a regular drinker. You will fall prey to these numbers. Now, how many 14-year-olds, eighth graders actually drink that way? Very few. More 17-year-olds do than 14-year-olds, and more 20-year-olds do than 17-year-olds. But basically, I'm not saying of these eighth graders, this number will become alcoholics. But if you drink that way, drink regularly at that age, if you give me 114-year-olds who drink regularly at that age, I will give you back in adulthood 47 alcoholics. So out of every 114-year-olds that drinks regularly, I'll give you back 47 alcoholics. Now, thankfully, the drinking cohort of 14-year-olds who act that way is very small. So not 47% of 14-year-olds, but 47% of the ones who drink regularly. If you wait till you're 17 to drink regularly, the number falls to 25%. Instead of 1 in 2, it's 1 in 4. You cut the risk in half. If you wait till you're 21 to drink regularly, you cut it to 9%, 1 in 11. So really, you cut the risk by enormous amounts by waiting 7 years to start your regular drinking. Now, here's the problem. Whose cooperation do we have to engage in order for this to come out best? 14-year-olds. And 14-year-olds, now, let's make sure we're clear. 14-year-olds do not lack intelligence. They lack the ability to put themselves into futures which contain them as adults living the consequences of decisions made today. Ultimately, it's the inability to perceive future consequences from current actions. It's not because you lack intelligence, by the way. It's because you literally, at this age, lack the brain structures required for that kind of work. Now, some people make it seem as though I'm saying you can't plan for a future. Yes, you can. You know what you're doing this afternoon in conservatory. You know what you're based. You know what your homework is. You know where you want to go to high school or college. You know where your family's going on vacation over the holidays. Basically, you can plan, but you can't put yourself effectively into a future living the consequence of decisions made today. For instance, if you went to a party where 114-year-olds were drinking regularly, and you said to that group, raise your hand if you're here currently working on your adult addiction alcohol, how many of them would go, yeah, that's me? None of them. Now, here's what you have to understand. Of the none who raise their hands, 47 of them will be that person. They are there working on their adult addiction alcohol. They just can't see it. Here's the thing. We have to make sure we understand how enormous these indicators are. If you take risk factor 2, runs in families, and early inception of use, you basically have this perfect storm where if you have these two risk factors in your life, what's the likelihood that you will come out the other end in some sort of substance use disorder? 80 to 90%. That's unbelievably powerful stuff. That's crazy powerful. The fourth risk factor is called tolerance. Now, we defined tolerance earlier as using a drug over time, changing the homeostatic balance in your body to account for the presence of the drug. That's use-based tolerance. This is different. This is genetic tolerance. Some people are born not feeling drugs like other people do, not feeling alcohol like other people do, and it's kind of counterintuitive because you say, if you drink and don't get drunk like others do, are you more likely to become an alcoholic? Why would I? That doesn't make sense. Here's the problem. If a person who's not highly genetically tolerant goes to a party and that person drinks 3 beers and they get completely hammered on that alcohol, and you're looking at them like, oh, okay, so you have 3 beers, but you don't feel anything. And you're like, wait a minute. Do you just go, okay, if this stuff doesn't work for me, maybe I'll just go home and do homework? Or are you like curious, why am I not feeling what they feel? So you have another beer. No, still not. No, okay, now I think I get it. Oh yeah, okay. So you get drunk on 6 and they get drunk on 3. Which person is more likely to become the alcoholic over time? The person who drinks 3 beers to get drunk, or the person who needs 6 to get drunk? it's really important to understand the counterintuitive nature of this. If you don't feel it, you tend to use more regularly and more frequently, and those are signs for problematic associations with future difficulties. Now, you have warning sign 3, early use, and you find out that you are highly tolerant, especially to the drug alcohol, your adult addiction rates to alcohol will hover at over 60%. So 2 and 3 together, 80 to 90% addiction rates. 3 and 4 together, over 60% addiction rates. What if you have 2, 3, and 4 as risk factors, like I did? It's not really looking good for you, especially if you start at an early age. This stuff is unbelievably additive and predictive of bad outcomes if you combine them together. But remember, there's another risk factor. This one has the weirdest name. It's called the wow factor, but it's also called the oh my God moment. Essentially, you use a drug and the experience you get from that use is, oh my God, that's the best thing I ever felt in my life. Do you follow that statement with this sentence? I'm never doing that again. No, it doesn't make sense at all. People who have substance use disorder will tell you the story of their lives, and almost every single one of them will tell you a story of the day their life changed. What day was that? That was the day they found the drug, which caused them to suffer from their use disorder. Really, the day they found the drug, that was the day their life changed. And it's almost always the same words. If you watch a movie called Beautiful Boy with Timothée Chalamet, he plays a character who becomes addicted to methamphetamine, and the words are so hauntingly similar to what addicts say. There was an emptiness inside me. When I finally found this drug, it was filled up for the first time. When I remember my usage history, if you remember from the introduction, I started smoking when I was 8, started drinking when I was 12, started smoking when I was 14. All of those things did things to my brain function, but they didn't trip this 5th warning sign. That was cocaine. When I did cocaine at the age of 18. Now, if you would ask me the day before I did cocaine, what's life like for you? Just give me a couple descriptors. Sad, lonely, fearful. That's the way I was terribly depressed. I was terribly affected I struggled a lot as a young person to find happiness in the world. Then I did the first line of cocaine at the age of 18, and I could finally tell you what the word joy meant. I was joyous in the presence of cocaine. Now, am I going to do that drug again? Yeah, why would I not? I finally found the answer to my I found a solution to my feelings, and it fixed me, and it was super powerful. Now, here's the problem. If that's the experience that you have, are you going to repeat it? Yeah, absolutely. Now, here's what my brain said at that point. You will do this drug in as great a quantity as possible, as often as possible, no matter what. No matter what it costs you, you have to do this again. It's that important. I gave cocaine for my job, my education, my health, my house, my cars, my first marriage. I would have given it my life if I had a few more years. I would have given it my life if I had the opportunity. But luckily, I got into rehab, and I didn't have to sacrifice the ultimate sacrifice. I didn't have to give my life to cocaine. But really, now here's the problem. I told you this is all based on stories that addicts tell. But if you remember from last year, I promised you this. I will never tell you a story because I like the way it sounds. I will only give you scientific facts and information upon which you can base your decision. So stories don't cut it. Stories are called anecdote. But the anecdote here of the day my life changed is supported by science. So basically, when we talk about science being important to us, it still is. And when we talk about addicts telling stories, here's basically what the stories are based on. They've done these things called adverse childhood experience studies. They're called ACE studies. So adverse childhood experiences, basically traumas visited upon very young people that cause them to be more likely to become substance abuse use disorder victims later in life. For each of these 10 traumas you experience, you are 2 to 4 times more likely to be addicted to drugs and alcohol in your adult life. If you have 5 of them at the same time, your chance of becoming an alcoholic or a drug addict or substance use disorder victim is 10 times greater. So what are the traumas? Extreme poverty when you're young, domestic violence in the home, which is extremely violent and ongoing, the loss of a parent to incarceration, mental illness, or death, sexual abuse or physical abuse when you're young. All of these traumas cause people to be more likely to experience this adult feeling of emptiness, of this adult wounding, and a drug seems to fix that, just seems to fix. So these traumas, drugs tend to treat them short term. They seem like the solution, but ultimately, here's the thing. Drugs never fix emotions long term. They don't fix feelings. They change the dynamic of your brain chemistry, but only for a short period of time, and then they wear off. And if you're one of the people who found salvation in that drug, what are you going to do when they wear off? You're going to chase them, and you're going to chase them again. And ultimately, this is the end. This is really bad. Now, here's the thing. How do you know if you have warning sign 4 or warning sign 5? It almost seems as though you have to use before you can figure this out. Please don't go looking for this. Understand that these risk factors are definitive of future consequences and difficulties. And if you don't have them, don't try to find them. But ultimately, you should understand where you are, what you're made of, where you want to go, and what things you want to avoid as far as risk factors are concerned. Thank you ever so much, 8th grade, for joining me today. I really appreciate it, or whatever grade you're in and watching this video. I really appreciate you being here today. Hopefully this information was helpful in allowing you to make informed choices about your futures. Thanks a million. Take care, you guys. Be good. Treat yourselves well. Bye-bye.